I got an invitation to come this morning from Catherine, who I've known for about a year. I discovered AAPS a year ago, a little over a year ago, when I was deciding what am I going to do with my practice. I'm a transplant nephrologist. I grew up in Canada. I trained there apart from my transplant fellowship in Portland. I've been in practice in Seattle since 1999. Nephrology is the medical specialty of kidney disease. These are patients who ultimately go on to dialysis if their diagnosis isn't made and their treatment isn't implemented. Since 1972, no one dies because they can't afford dialysis. It's a law, it's the nodal law. Dialysis patients are covered, all their treatments are covered by Medicare. Kidney diseases tend to affect older patients. Diabetes and high blood pressure are the number 1 and 2 causes. 1 in 10 Americans have some form of kidney disease. And so my practice is mostly Medicare. And what I'd like to do in 5 minutes is explain some financial and business aspects that all of your doctors are experiencing. I risk casting myself and other doctors in a bad light. Doctors don't like to talk about money. They don't like to talk about business to their patients because we come across as greedy. I'm going to risk crossing that barrier because this is stuff you need to know. Your doctor's silence will eventually end up in you not being able to see your doctor. And the good message from every commercial, from Viagra to any pharmaceutical, is the end that says talk to your doctor. And that's what I would like you to do with information that you received tonight, is ask your doctor, hey, I heard this. Is this what's happening in your practice? So the business of medicine is, I see a patient and I submit a bill on your behalf to the government, if you have Medicare. For a level 4 visit, which is medium complexity, 25 minutes, I would be paid $82. And you may have been following that there are projected Medicare cuts because Medicare is a pyramid scheme where the younger workers pay for the benefits of the older. And the tragedy of this is the older workers have already paid into this. And so we're stuck. We're stuck. Patients expect benefit, younger people pay, have no expectation of benefit, and the benefits are declining. And there are projected decreases in reimbursement for doctors, and this is known. This is known. Doctors are here that there's going to be a 20.5% pay cut in Medicare in January 2010. This is regardless of what happens with Obamacare. There are fiscal realities which cannot be escaped. This is unsustainable. So if you're in a practice where you look after elderly patients, where your patient population is 60% Medicare plus, and you're being told that, well, you're going to be paid 20% less for those, you have a few options. Number 1 is see 20% more patients. I was already seeing 20, 25 patients a day. Patients I see don't just have a cough, they have 4 or 5 problems. It's multiply complex. I need time, I need curiosity, I need to be able to think and communicate with other doctors. So I can't see more people in a day, so I have to squeeze patients into a shorter amount of time. This is an honest reality of practice today. And if you've ever been kept waiting to see your doctor, if you've ever wondered why your doctor's in a hurry, does your doctor seem to be thinking about either the patient at go or in the next room? That's why. There is a time pressure. And this is really what saps at the joy of medicine, and patients see it and the doctors know it. Doctors are looking for an exit strategy. Doctors want to exit this profession. It is just, they just can't provide good care. Doctors have to reach a tough decision, a personal decision, and that is, you either follow this fiscal train where it's going, go out of business, in which case you're no good to anyone. You have to acknowledge that medical care in the U.S. is a business, and we provide a service, and that service has a value, and I have overhead in order to provide that service, and regardless of what the government tells me is the cost or the value that they determine, I still have to pay my rent, I still have to pay my staff, and at some point I can't do it, and I shut the doors. So, I turn to the APS for some advice. And there's some very smart and very bold doctors, Dr. Schlitt, one of them, who have opted out of Medicare. And on August 1st last year, I sent letters to all my patients letting them know I'm going to opt out of Medicare, Medicaid, and all private pay insurance. I kicked the government out of my practice. And half my patients left. And it was very sad to see people who I've looked after a long time leave. I helped them find other doctors who take their insurance. A lot of patients stayed, and they realized what I do, that government is intruding, that government is setting an arbitrary value, and that that's not reality. What about the uninsured? What about the people who need to but don't have resources? Well, it may come up, we can debate how many people are actually uninsured in this country. But let's assume that there are people who are uninsured and have no means. I was taking care of Medicaid patients, and I invited all of them to stay. They can't pay. My fees are on my website. I charge $180 a half hour. I see transplanted patients. They are multiply complex. That takes 3/4 of an hour. And I have a philosophy that there's always someone less fortunate than you. And I would tell those Medicaid patients, I will help you if you help me help someone else. So I have a box for the food bank in my office. And I say, bring me a bag of groceries and we'll call it good. So I'm able to... So by kicking government out, I can be a good doctor, I can practice the way I've been trained, I can take my time, be thorough, I can be a good friend, and I can be a good neighbor to the patients who've come to rely on me. So that's it.
Thank you, Dr. Patrick. Our fourth speaker is someone that I have known for a long time. We met on the road against celery care. And I stayed such a captain for a long time. I don't know how to describe her besides a ball of energy. When she was calling and emailing me from here when I was in LA, she was doing all the footwork. I couldn't do any of it. All I did was talk on the air and invite all of you. She did all the rest of it. She set up this whole thing. And she's one of those people who does work behind the scenes, but she's one of the people that, because of her work, we win. And it's going to be because of the Catherine Cirques of the world that we win this fight, because they're doing all the hard work behind the scenes and mobilizing people to teach you and motivate you to go out and fight. And so, Catherine,